So my name is Chad Prodromos. I'm an orthopedic surgeon. My practice is now entirely regenerative medicine as of 6 months ago when I stopped operating after 38 years. I grew up in Chicago. I got a bachelor's degree from Princeton, an MD from Johns Hopkins, did my internship at the U of Chicago, a residency at Rush, a fellowship in sports medicine and orthopedics at Harvard and the Mass General Hospital. I was assistant professor of orthopedic surgery at Rush for 27 years. I'm editor-in-chief of the standard orthopedic textbook on the anterior cruciate ligament. I'm founder of the Prodromos Stem Cell Institute and the Foundation for Regenerative Medicine. We have dozens of publications in high-quality PubMed indexed journals. That means high-quality journals. Over the next 45 minutes before taking questions, I will talk about a wide spectrum of effective clinical applications for stem cell treatment, sometimes with results so amazing that I would think them apocryphal if I did not witness them with my own eyes. So the first effective motor restorative treatment for paraplegia. I'll read some of these, not most of them. There is no treatment offered elsewhere that has ever been shown to improve paraplegics more than one motor level, which cannot restore the ability to walk. The stem cell treatment we offer, which is combined with the use of your own lymphocytes, is capable of restoring to a significant degree most of the affected levels and can restore the ability to walk. This same treatment can also significantly restore deficits after stroke for which no other effective treatment exists. So this is a video without sound. There's a title though. So ASIA means a complete lesion, T12 paraplegic about the level of the belly button. This was after a car accident. This lady for 10 years, she's from Argentina, did not have the ability to walk. You can see that her muscles are very skinny and her legs, she has no active motion below her waist. She was treated with a combination of stem cells and lymphocytes, which we call effector cells. I'll talk about this a little more later. She's had 10 infusions also into her muscles. So this is her. This is a former complete paraplegic, wheel-bound paraplegic. She's also had injections of muscle cells into her muscles, which were very atrophic, and is doing all of this. Treatment is currently ongoing, and further treatment is expected. This is a paraplegic. She had use of her arms, but not her legs. This is a C5 quadriplegic. Quadriplegics are people that break their necks and they can't use their legs. They don't have grip function. Some of them have varying degrees of function higher up in the shoulders, for example. This is C5, which means that this person could shrug their shoulders. They could lift their elbows away from their body a little, flex their elbow a little bit, but no triceps, and that was all. So this is this person after treatment. As you can see, he's standing. He's a little sway back because he didn't have any trunk muscles either, and he used to have to be strapped into a wheelchair, but is now able to support his weight. You can see he's gripping, he's able to push down, and he takes a couple of steps here. So he wasn't respirator dependent, but he was in a wheelchair and had no function of arm or legs. This is his triceps, which he didn't used to have. It's below his level. Latissimus pulling down, which he also did not used to have. So this treatment occurs no place else in the world, and we have many more. Actually, I had more people in here, and I've got some slides at the end, but we have a lot to cover. This is, I don't know how well you can see this, and I don't think I have a pointer, but if you look here, so this is an ultrasound. This white stuff is called fascia. This is where muscle should be more fascia. That's like a fibrous coating and more muscle. This is mostly black. It's mostly fat because the person's lost muscle. If you look here, that's before treatment, and this is 4 months after treatment, injection of muscle cells. Do you see how this is more white here than this here? Yes. That's new muscle, okay, that's formed. Because they found that if people get treated and their nerves function again, but they don't have any muscle, they can't function very well. Now also before, the white is fascia, which is the coating. But you see here how there's a lot of white kind of disorganized? So that's scar. Scar and fascia are made of the same stuff. So there's a lot of scarring before treatment. If you look here after treatment, this is the same as that. It's now an organized layer. The scarring is mostly gone. So pretty remarkable treatment. This is a girl who had something called microcephaly, where her, so she was born with a small head. They operated to make her head, so that wasn't a problem, but her brain just didn't develop. It's basically cerebral palsy. They called us, she was 10 years old, and nothing else had really worked, and they knew about us. She's from Sao Paulo, Brazil. We did a Zoom call from Sao Paulo, Brazil, and treated her. So this is her before, and she had not phonated, could not control her head, and she had spasticity and rigidity. So this is her. This is the top of her head. And she's mute, as you can hear. Her arms are stiff. She was treated with effector cells and stem cells, the same as the spinal cord people. This shows her a few weeks later after her first effector cell treatment. This was about 3 weeks. She now has the ability to support her head, phonate, and smile. This is back in Brazil with her physical therapist. So, and you can see she controls her head, she's phonating, she's less rigid, and she's smiling. She's smiling because for the first time in her life, really, she has some hope, she's functioning better. That was after one treatment. She's in treatment now. She'll be getting her second. She might have already gotten it a couple of weeks ago. Right now, not totally sure. This was done in Monterrey, Mexico. We'll talk to you about that. We unfortunately can't do these treatments here. So I'm going to move on from this. I said it might seem a little choppy. There's just a lot of different things to cover. So this was central nervous system problems, brain and spinal cord. Peripheral nerves are beneficially affected well. We had a 48-year-old patient who had a femoral artery repair that didn't go well, and his leg below the knee was numb, and he had very little strength in his foot. This is 1998. We treated him in 2022. Our pain specialist injected both perineal nerves, 2 nerves in the leg, and the anterior tibial artery along their entire length under ultrasound, a technique that had never before been reported. 2 weeks later, he began to have return of sensation. 2 days later, he began to have some return of sensation. By 6 days after, he had complete return of sensation and roughly 50% increase in foot strength, 24 years after his injury. Tony Robbins, many of you are familiar with. He's a philanthropist, motivational speaker, businessman. He visited me in Antigua 6-8 months ago, and came with his private plane and his entourage because they were looking. He wrote a book called Life Force. He hadn't written it then, but they were interested in stem cell treatment, and he had a long time interest in it. And he spent the day there and interviewed us. And he said, I'm writing this book, and I'd like to put you in it, but it goes to press tonight. And he said, I don't know if I can get you in it. But he wound up having a little piece in there about us. So this says, I don't know if you can read this, but it says who I am. He says his passion of preserving rather than replacing joints has led him to becoming a world leader in the use of stem cells to avoid joint replacements for arthritis. Due to FDA limitations in the U.S., he opened a center in beautiful Antigua because the Prime Minister, Gaston Brown, has declared his goal to make the beautiful destination the stem cell capital of the world. Now in this environment, he's able to use cultured umbilical cord cells, I'll talk to you about these, and is able to avoid joint replacement in most severely arthritic patients he sees, while never using destructive cortisone and stopping all pain-killing and anti-inflammatory medicines. With well over 1 million joint replacements performed annually in the USA, the public health implications are staggering. To reinforce, most of the people we see wind up not needing surgery, and to also reinforce, cortisone destroys cartilage, and if you have arthritis, you should not get a cortisone injection. Nothing against the good doctors who may be suggesting it, but it makes joints worse. I don't have time in this talk to talk about it, but there's abundant literature about it. He was we're grateful to him. He's a free-thinking, inquisitive person who I think's done a great service with this book. Even bone-on-bone patients of the knee, shoulder, and ankle generally do well. And we now have a technique to actually grow new cartilage, documented by MRI. This is offered nowhere else in the world. We're treating our first patients with it. Actually, we just treated our first patients with it about 3 weeks ago in Monterrey. Also, will reduce scarring. And so, I noticed, I said knee, shoulder, and ankle, really bad hips had not responded to what we've done because there was so much scarring and stiffness. But we're able to do these now, and we've just treated our first 2 patients. So this is a lady from Naples.
I was diagnosed with bilateral arthritis, and spoke with several excellent doctors here in Naples, but was never given a good option in terms of treatment other than let me know when you need surgery. So Dr. Prodromos gave me the option of going out of the country to have the stem cell treatment, which we did. The procedure was very smooth operation. It was, I wouldn't call it painful. It was maybe a little uncomfortable, but it was a fairly easy treatment process, which was very nice. The recovery time was minimal. It's been about six full months now since my treatment, so I think I'm at a full benefit from this point from the treatment. So totally different from prior to the treatment. I played golf this morning, shot a 79. I can play golf as often as I want without any pain or discomfort, which is incredible. I easily get through my workouts now. They were more of a grind in terms of trying to find positions where I could do things and not feel pain. Stem cell therapy is life-changing. The research that Dr. Prodromos is doing is extraordinary. He is certainly changed my life, and I'm sure many others who I haven't had the opportunity to meet.
That was 6 months after I saw her again for something else, and it's either 15 or 18 months after, and she's still doing well. Sports medicine. We regularly treat recreational and professional athletes. Stem cells can improve focus in our treated NFL quarterbacks, which is why they come and help injuries heal more quickly in all athletes. So, the incredible journey of how the Bucs' Ryan Jensen returned from a career-threatening injury. And by the way, I don't ever talk about my patients unless they tell me they want me to, like the last lady and the people you'll see here, and especially the professional athletes. What I'm about to tell you, Ryan wanted told. So here's the story. So Ryan's a Pro Bowl center, 6'6", 320 pounds, Tampa Bay Buccaneers, Tom Brady's center. And in July in training camp, he had a horrible knee injury where he was rolled up onto and tore his ACL, his PCL, his MCL, his meniscus, 2 little tibial fractures. His agent actually called me, actually that same day, and said that surgery's been recommended. Do you think stem cell treatment would help after surgery to recover better? And I said it probably would, but he shouldn't have surgery. And the reason for that is, so I'm a 38 years running knee specialist, right? Editor of the textbook on the ACL for orthopedic surgeons. I just stopped, as I said, 6-9 months ago because I didn't really have time to do it anymore. But if you fix the ACL, people do well if you know how to do it. But multi-ligament injured knees like this, if you go in as the orthopedic surgeon and try to do it, it's a big, long operation. There's lots of scarring, and often the results are not good. Now, on top of that, there is good evidence that the MCL, and see, ligaments like to heal. Through evolution, we've evolved that ligaments heal. Ones that don't heal are outliers. The ACL is an exception in not healing. So there have been good studies that the MCL and PCL will heal. And through my career, there's a guy named Don Shelbourne, who I'll tell you about, who did the research on this. And this is what I've done in multi-ligament injured people, is treated them with bracing and rehab. So I said to his agent, I said he shouldn't have surgery. And so he called the player talked to me. So he saw 5 other orthopedic surgeons. All 5 recommended surgery. This is actually, he was interviewed at a press conference, he describes this, and I didn't. And I didn't want to treat him myself because I just stopped operating and I thought he'd need his ACL done and I wouldn't be in a position to do it. And also, so I sent him to Don Shelbourne, who's the person who had done all the research on this anyway. He's a great guy in Indianapolis. So I said, you should go to him. And he did. So he went to Indianapolis, he was treated with bracing and rehab in Dr. Shelbourne's expert hands, and the PCL and the MCL healed, and they were seen to heal. So that left the ACL. And then the ACL healed too, because it may not have been 100% torn. The meniscus scarred down, the tibial plateau fractures healed. So this is 3 months or so afterwards. So I said, and we discussed, I said stem cell treatment should have the ability to accelerate the healing of these ligaments and increase, based on some animal studies at least, their ultimate tensile strength for a big guy like you. So then he came to Antigua, and we infused him with stem cells for that reason. And I don't have the dates exactly, but this is maybe 4 months afterward. But I told him, yes?
You said the meniscus healed?
Yeah, the meniscus can scar down and heal. They don't all need to be fixed, contrary to what you might think. And so but I told him from the start, I said, look, even without surgery and everything else, this is going to be a while. So you should not play this year. If you try to go back, and he was concerned at that point if they made it to the Super Bowl, can I go back? And I said, no, don't. It's just, it will be too soon. I think you're going to do well, but you can't push it. And he said, okay. Well, he was around training camp, and he looked good. And so I don't know exactly what went on there, but the long and the short of it is they took him off injured reserve so he could be activated if they wanted him to. And I heard about this, and I said, Ryan, please, don't think about this. And he said, okay, I won't. And then they activated him, and he was just doing drills, and he said that Tom Brady was more comfortable with him out there and whatnot. And then I said, Ryan, it's just too soon. You're gonna do great. And he said he wouldn't, and then he did. And he played. Not only did he play, but he played the whole game, 80 snaps. And he was interviewed afterward, and he said, I'm a football player. That's what I do. If I can play, I got to help my guys. So he played the whole game, 80 snaps. He said he was sore afterward, but nothing bad happened. They lost, for which I was grateful, so I didn't have to worry about it the next week. But this is 5 months after this kind of an injury. I mean, even just isolated ACLs are usually 9 months at least. So he said, I need to tell this story so that other people can benefit by it. So they got a great writer, Dan Pompey, and they wrote a story in The Athletic. It's a high-end sports publication, and it just came out 2 weeks ago, maybe. And again, the only reason I'm telling you this story is because Ryan wanted it told. And I wrote in that article, I said, this is an example, I think, of what you can do when you're the combination of what's the best standard treatment, which is what he had, with regenerative medicine treatment. Alex Guinness, high-end skier, U.S. national ski team. 6 knee operations. So he was a great skier, but he underperformed due to that. So he said, do you think stem cells would help? I said, probably so. So February of last year, he came to Antigua. We injected both knees, because both knees were kind of messed up. One had just had surgery with stem cells. That was February. He wrote this testimonial afterwards. He said, I must say it's done wonders to my left knee. Since the injections, I've seen great improvement. That was the bad one that had most of the operations on a day-to-day basis. The crackling has subsided to a point where I don't really notice it anymore. My knee does not require the sort of attention it required 6 months ago after training sessions, and long travel days aren't a bother anymore. As I'm gearing up for the upcoming season, I'd like to thank Dr. Prodromos for taking care of me and making my knee somewhat normal again. This is last spring. And I didn't hear from him again, and I don't really follow the ski circuit. Last time I talked to him, he was in a glacier in France skiing. It was sort of warmish out. And so then, 2 weeks ago, I got this email. Just wanted to thank you again for the injections. Was able to write some ski racing history the other day. So what happened, by the way? So he was born in Greece and was in the U.S., on the U.S. team. When he got hurt, the Greek government poached him. And because he'd been born there, they said, you can ski for us, and we'll give you a better deal to rehab. So he went on to Greece's team. He said, made history the other day by becoming the first Greek to podium at a world championship event in ski racing. Thank you again times a million. So then he, just last week, February 19th, at the alpine skiing, which as he explained is the whole world skiers, he earned the silver medal. This is Greece's first medal in any winter sport of any kind. And I talked to him, and he told me, he said, yeah, after you did it, he said, the cracking went down and I was better through the spring. He said that in June, all my pain, this last 2022? Yeah, 2020, he said all my pain went away. And then he skied, and this was better than he had ever done after 6 knee operations. And the credits to him, he's got great genes, he's a great guy, hardworking, rehabbed well, but did the stem cells allow him to do better than he had ever done despite all the rehab? We both think so. And we treat plenty of other people. As I say, these two wanted to tell their story. We just had a couple of NFL players down. We were down there a couple of weeks ago. So moving on, back pain. This is a publication. I have a foundation. We publish in good journals. This is a case report. We've done 44 backs. This was the first patient, and this is published in a good journal. First human report of relief of lumbar and cervical discogenic and arthritic back pain after epidural and facet joint mesenchymal stem injection. So here's the story. This is a 47-year-old man. He was well-to-do. and he had a bad back. And he said he had 13 years of back pain, requiring pain pills by his bed at night and interfering with sleep. So I theorized as we started using stem cells, and because it's so restricted here, it isn't like there's tons of literature on this. So we read everything, we see what other people have done here and there, and we try to build on it. So stem cells home to damage. So I theorized that if you do the simple, it's called a translaminar epidural injection, just stick it in the space without having to put it right on the nerve, or sometimes it can be tricky, that it would spread out and do benefit. So we started this. So we do a simple translaminar epidural injection. Dr. Candido does in his hands. It's a 5-minute thing under local, and also injected the facet joints. Now again, he's got great hands. These are little bitty joints. He injects them under local quickly. But you lie down on the table, do this whole thing takes 35 minutes. This patient, the Thursday after the Saturday, he called us and he said, my pain is basically gone after 13 years. He said, I can sleep again. And he was very happy. But in addition, he was sent to me by Rick Fessler. He's the chairman of spine surgery at Rush. In my opinion, the best spine surgeon on the planet. And prior to me seeing him, he'd had a neck problem. And he had a bad herniated disc, weakness of his arm. Dr. Fessler put in an artificial disc in his neck, which helped him a lot. His function got better, pain got better, but not completely. He had residual neck and arm pain. So we weren't even treating that. We were treating his back. And we just put these cells in the lumbar spine, the lower back. So he told us, he said, my neck also. I had pain in my neck and some residual arm pain. He said, that's gone too. And we were very surprised by this. But what happened, obviously, is these cells from the epidural space in the lumbar spine at the bottom of your back found damage upward in the epidural space and sought it out and homed to it and treated it. So this had never been reported, and we've seen it repeatedly since then. So when we treat necks now, we just inject in the lumbar spine for the epidural space because these cells have this remarkable homing capacity. We've done 43 patients. We have follow-up on just about all of them except one. We're writing a paper. That was the first patient in a series. We're trying to get follow-up on the rest. I was just talking to my research team. We follow up all our patients. And I have a full-time research team. I don't get anything out of doing this. It's expensive. They're great. They're smart. I have to pay them. I pay them out of practice income and whatnot. But you just don't know what you're doing otherwise. So we want our good results. We want our bad results. The first 39 patients, 35 of them did well. Four of them, nothing happened, and one of the 35 did well, and I found regressed some after 3 to 6 weeks. That's what I know right now, but we're going to write this up. But those are still pretty good odds, and we had one gentleman who had failed spine fusion, got infected, they took the hardware out, still infected, they operated again, got rid of the infection, chronic pain, and we injected him and injected his discs, and he got 20% better at 1 month, 40% at 2 months, and to make a long story short, by 6 months his pain was gone, and he's a year now. So many of these people are pretty severely affected. And spine surgery, I've got good friends who are spine surgeons, and it can be great in some cases, but when it fails, it often fails catastrophically. So spine surgery is great when you need it, but if you can do something to avoid it that's non-invasive, that's safe, we all think it's a good idea. So some facts about stem cells. Mesenchymal stem cells are cells that are programmed to help us heal from within and to modulate the immune system. They are abundant in umbilical cords obtained from ladies after term cesarean sections. We use cells from Vitro Biopharma in Golden, Colorado. They are not embryonic, fetal, or related to abortion. 20 years ago, there were all kinds of ethical concerns. This is not that. These are not embryos. These are post-term people. These umbilical cords are donated. They do not have HLA type 2 antigens that cause rejection, so there's no rejection of them. They are FDA registered. They have international certifications. Every batch is tested. They're 100% safe. We've never had a serious adverse event in anybody. They are obtained from tested donors. They're incredibly safe. When properly used, as evidenced by our published systematic reviews of the scientific literature. We published 3 papers on safety of these things. We review the entire literature. If you go to our website, all these papers are on there for those of you who are so inclined. Autologous, meaning your own cells, versus allogeneic. We use allogeneic umbilical cord cells for most disorders. That means these umbilical cells. They're easier to use, they're less expensive, they're very active because the cells are young. For spinal cord injury, retinal disease, hearing loss, and some other disorders, we use the patient's own stem cells in conjunction with their own activated lymphocytes, or effector cells. I'm not going through how that works. I can tell you it just gets complicated and I have limited time. But we take a patient's own lymphocytes and train them, activate them. They go to damaged tissue. The stem cells home to the lymphocytes. This is how you heal. For those people, we need your own cells. So we take a specimen of their own fat, and those cells are grown in culture. All of this outside the United States, either in Buenos Aires, Argentina, or more often now in Monterrey, Mexico, where we have a center set up. No serious adverse event in any patient with either cell type. And we follow up all our patients, which is unusual in this space. We don't have to do this. Patients that like you find you, and they say, you're so great, doctor, we love you. But the patients that don't do so well don't find you. We are really interested in everybody. If there's patients who fail or don't like us, we want to know why and how. So we follow up everybody. Stem cell regulations. Properly used, they are extraordinarily safe, far safer than pharmaceutical drugs and surgery, and formerly were freely used worldwide with very few problems. However, dating back to 1976 when they were discovered. However, in 2005, the FDA decided to regulate their use such that, accepting small studies that very few patients can get into, stem cell centers have been driven offshore, just like we are in Antigua or in Monterrey, and there are some others. We work at outstanding medical centers in Antigua and Monterrey, actually San Pedro Garza Garcia. It's a suburb of Monterrey. It is listed as the most upscale community in all of Mexico and Latin America, and it is. Beautiful restaurants and shops. We go down there and we do, I think, great work and have a great time as well, completely safe. Stem cells outperform pharmaceutical drugs safely from many problems. Pharma cannot monetize their use or patent this, and therefore does not sponsor them. And, why should they, right? But what happens is that the finances that would be needed to fund big double-blind randomized placebo-controlled studies, so the FDI would legalize them, just doesn't exist. These are $100 million studies. We always inject intravenously. So even when we inject in the back, we inject intravenously because there are circulating inflammatory factors, for example, with back pain, that make this, we think all of this is somewhat of a systemic disease. They can also be injected in arthritic joints and tendons. So at our center, I have one of the world's best pain doctors injecting the back. I could do that, but he's much better at it than I. If there are peripheral joints, I do it, knees and shoulders and ankles, because that's what I do. We have a good urologist for ED and other specialists. It can also be injected into damaged nerves and elsewhere. So I'm going to move on. Stem cell treatment for autoimmune disease. It is particularly good for MS, where a T-cell vaccine made from the patient's own lymphocytes has produced long-term remission over 20 years, potentially cures in nearly 200 treated patients. So this is also very good for scleroderma. I'm going to read you a testimonial, as well as rheumatoid arthritis, psoriasis, polymyalgia rheumatica, type 1 diabetes, and other autoimmune disorders. This is a rheumatoid arthritis patient.
I've had rheumatoid arthritis since 2004. With the rheumatoid, you get flares, and at times I have to have like my son or my husband open things for me, or even reach something because it just, the muscle ache and everything. I've been on, drugs and prednisone forever, it seems like, since 2008, and it really is hard on your body. But I would flare, and then with the flare, then you'd have to get a shot of cortisone. And I'd walk out of my appointments with 6 shots in my hands or in my feet, and it's painful. And then hopefully that works, or they'd have to put me on a high dose of prednisone, methylprednisone packs and everything. It got to the point where it wasn't even working anymore. So I got the stem cell treatment. After that, after the wrist calmed down, I don't have my wrist braces on anymore. So I have that movement again. My shoulders aren't hurting anymore. I'm walking better. I had it in my wrist. My back was continuously going out, and that, prevents you from doing things. That's a ton better. I have so many friends with autoimmune diseases, friends with kids with autism, type 1 diabetes. I have been telling people about this. I guess that is the final thought. I want to see so many people healed with this that I do hope that it gets more prevalent. I do want to go do this again because I think it would give me even more benefits.
Her wrists were so mangled that the bones, it was like candle wax, were like melted. The wrist bones were dislocated off of the forearm bone. Somebody suggested fusion, but I don't think you could fuse this because you'd have to put it back and they'd be likely to have neurovascular injury. So it doesn't get a whole lot worse than that. Another patient. Multifocal motor neuron neuropathy. You probably can't read this, but initially diagnosed as ALS. No treatment had helped. 6 feet tall, formerly 200 pounds. He's a accomplished businessman from South Carolina, referred to us by another patient, North Carolina. He worked out vigorously prior to, but he lost weight to 128 pounds when we began to treat him with progressive weakness, breathing, and swallowing difficulties. He was declining steadily and had a grim prognosis. His wife called us. He had mold. It turns out he went to a mold specialist, and the mold specialist got rid of the mold. So they got rid of the mold, but he didn't get better. And then they were desperate. They called us. His wife called to see if stem cells could help, having tried everything else. The following shows him before and after treatment with a T-cell vaccine, like for MS, in Monterrey, Mexico, with significant improvement in only a few weeks. This video and statement was sent to us unsolicited from his patient and his wife for our information and for allow others to see the power of this treatment. This is before.
My body needs a complete realignment. As the day goes on, it wants to fold over. It's becoming increasingly difficult to open back up.
It's gone. Go ahead.
It's August 9th, and
6:47 a.m.
yep, just slept through the night, which is something I haven't done in years without having to get up. I was very comfortable to sleep. Normally, early in the morning, I try not to speak virtually at all. I just took a full drink of my water, which is difficult to do. And my voice is more clear right now than it has been in days, if not months.
And then she wrote this. We are so happy Rob slept all night long. He hasn't slept all night in years, awake now and very alert and unusually strong voice, feeling really good. Just told me that he gulped his water, which is something else he hasn't done in a very long time. Working at his desk most of the day, smiling, and I'm smiling too. Can't wait to return to Mexico next week for more of this, and thank you. It took 2 days to stabilize him before he could even be treated because he was so sick when he got there. Moving on. And so he turned out to have an autoimmune disorder, polymotor neuron neuropathy, kind of like MS, that was set in by the mold. It wasn't the mold directly that was doing it. We've had good success with macular degeneration, diabetic retinopathy, retinitis pigmentosa, treating a patient now. These injections are IV and completely safe. There is no need to inject into the eye. We are trying to obtain funding to begin a preclinical animal trial for glaucoma. We hypothesize that it would benefit too, but nobody knows. If successful, we need about $80,000 to do this, an animal study. And if successful, we'll be able to offer it to patients within 6 months. So scleroderma, I don't know if any of you have heard of this disease, but it's a horrible autoimmune disease. It's disfiguring. People eventually die from it. So this is a long letter written by a patient who we treated. It's pretty long, but I'm going to read the whole thing, okay? This disease is otherwise untreatable. I've talked to rheumatologists who say, just nothing I can do. They're happy they don't have more patients with it because there's very little you can do. Over the course of last year, I worked with Dr. Prodromos and his colleagues to help me with a severe autoimmune disease called scleroderma. Scleroderma causes the body to produce too much collagen, which in turn hardens your skin and internal organs in some cases. I experienced both. Before my first treatment, my skin and my face was tight, and I was unable to smile on one side of my face. I had difficulty breathing to the point where I had to rest when I walked up a flight of stairs, had difficulty walking up my driveway after retrieving the mail, was in constant muscle and joint pain, my hands would swell and look like sausages, and my esophagus became so tight I had difficulty eating and became nauseated when I did and just lacked energy. I used to ride my bike and enjoy cycling trips, loved hiking and snow skiing. All of that was impossible. I kept trying to push myself to exercise, and the following day I would have a flare which left me in bed most of the day. Depression set in as I tried to adjust to my new life. I became acquainted with Dr. Prodromos after reading Tony Robbins' book, Life Force. I met with him and his colleagues via Zoom. They did not promise a cure, but I felt hope. After much research and prayer, I decided it was best to get the treatments. After the first treatment, I found I had more energy. I noticed the pain had subsided in the mornings when I first got out of bed. Normally, it would take about 20 minutes of walking before I could walk at a normal pace, but now I had no lag. Improvements continued to happen after each treatment. After the 5th treatment, I had little pain. I was able to hike up a 2,000-foot elevation gain in Colorado at 8,000 feet. I was able to digest food better and started to gain some of my weight back. Also, my skin softened on my face, and I was able to have a full smile. I feel like I got most of my life back. I still have some issues, but with a diet of eliminating sugar and dairy, I can almost have a normal life again. I am so grateful for these doctors who are offering these treatments, and it was worth every penny I spent. At the last infusion, a doctor was the patient in the next chair to me. If a doctor seeks treatment there, I sure felt like I was in good company and safe. And you know, we are anxious to treat these people. They're miserable, and we can help them, and others can't. And one of the purposes of these talks, if you know people with this disorder and are so inclined, send them to us. We will evaluate them free of charge. Not everything needs stem cell treatment, but disorders that are severe, for which there isn't other treatment, for which stem cell treatment is useful, are on that list, and this is on that list. Autism. Autism has been found, I put autoimmune, I should have said immune-mediated disorder. Stem cells are able to cross the blood-brain barrier with a simple IV infusion in people who have inflamed nervous systems, which these patients do, and produce remarkable results in part by modulating the immune system and in part, we believe, by helping heal damaged neurons. So we read some reports of autism being helped, and I thought, you know, why? Why would it help autism? And then we have a file now of something like 70 papers showing that these people with it have derangements in their immune system. Sometimes their mothers do too. So once you understand that it's immune-mediated and recognizing that one of the things that stem cells do is modulate the immune system, it makes sense why it would work. We also perform EEG studies performed by Tim Royer, who does a lot of NFL players and others, before and after treatment, and have seen remarkable improvement in brainwave studies paralleling behavioral improvement. And we are very data-driven. You know, we could see people and they do well, and that's great, but we're always looking for data so we can find out objectively, so we can publish it and we can teach others. This is a letter which I would like to read. His mother was a high-end ENT doctor in the Hamptons, and she gave up her practice to deal with him. He's in his 20s. She's an amazing woman. She has a thing called Autism Homes, and they open homes for kids with autism and does a lot of other things. So someone else at their church had been treated by us, and they found out about it, and she called us. Her husband's a physician too. And she wrote this. She volunteered this for others. I would like to thank you, it's addressed to me, for your care of my son Michael. As you know, he's 24 and severely autistic. His stem cell treatment was April 2022 in your clinic in Antigua. The experience is very pleasant, very professional. Michael did very well and was very calm during and after the treatment. This is a simple IV for about 45 minutes. Since the treatment, 5 weeks ago, he has been sleeping through the night, which he did not do before. Before, he was waking up 2 to 3 times. He's communicating verbally more. He has also stopped his risperidone. So he became agitated, and they had to use risperidone. It's an antipsychotic drug. It was the only way to control him, but it makes you a zombie. So before he came, I said to his mother, to the doctor, I said, why don't you just stop it for 2 weeks and let's see what happens. So he came, didn't have it. We did it, no problems, 2 weeks, 4 weeks, 6 weeks, and he's been off it now a year with no problems. He has his personality back. We did pre and post EEG treating through Dr. Royer and have showed significant improvement in his prior high-speed brain waves, which signal an excessive sympathetic drive and improved brain recovery from his improved sleep. This is a sign of agitation in your brain. So they can see it clinically, we can see it objectively with this. We are thrilled with this progress and understand that we will continue to see improvement over the next several months. She has actually set up a lab in the Hamptons, and they bring autistic kids there. She bought EEG machines, and they're doing EEGs to help with our research. So autism is something else on this list. There's very little you can do for autism. There's therapy and whatnot. A lot of people who try very hard to do a lot of things, but it doesn't usually affect it much. This treatment does, and it can affect it in very severely affected patients, and it's easy. It's just an IV. The only problem we recently did a 4-year-old and a 6-year-old, and they weren't real crazy about having an IV. So we have an anesthesiologist who sedates them a little bit. We put the IV in, run the IV, and then do it afterwards. But there's no pain, no side effects, and it's effective and repeated. And just about all of our patients want to keep on doing this. So moving on, ED. A local injection and IV is generally effective for diabetic ED. And there's published literature on this. And is often effective for other causes of ED, although less predictably. Infertility. Stem cell injection into the ovarian area can result in conception for infertile couples. It can start ovulation again, and also after failed IV fertilization. Evidence that about 30% of people who fail IVF with stem cell treatment can carry through a pregnancy. There is also evidence that stem cell injection can increase sperm count, which is down dramatically in males worldwide, as you may know. We offer this in Antigua. It's kind of a long story, but we will probably be opening a center in Greece. Western Europe and the US are very restrictive for these things. We're actually wanting to set up, actually something else that I didn't put in here, and maybe I should have. If you inject people with stem cells who break their neck or their back, who will become paralyzed, if you do it between day 7 and 12 after the injury, it greatly mitigates the paralysis. And I actually have a video. There was someone, but how are you going to do that, right? If someone in New York breaks his back, they get stabilized, they have surgery, and then you have to airlift them down, and it just sort of doesn't happen. There was a gentleman who broke his neck in Antigua, though, and they had a spine surgeon come in from the UK to perform the surgery. And so at 11 o'clock at night, I got a call from the operating room. They were operating. And he said, "Hey, Chad," said the doctor there. He said, "Do you think stem cells would help this?" And I said, "I don't know." It was the 14th day afterward. The window is usually 7 to 12 days. So I don't know. Why don't you try? And so they did. They gave him 200 million stem cells IV. And I should have put this in here, but I didn't really know. He had a thing called central cord syndrome. So his arms were flaccid. He couldn't move his arms basically at all. His legs were not so bad. So a couple of months ago, I got a little video of a guy in an elliptical using his arms very vigorously. And then he said, "You know who that is?" He said, "That's this guy." And this was, I don't know, 6 months, whatever it is afterwards. And his arms had almost fully recovered after being paralyzed. So we would love to do this, but we can't do it here. So I don't want to digress too much, but Greece, some countries in Europe don't have regulations against stem cells, and Greece is one of them. You have to get approval by a hospital and some other things. So we're in the process now. I've got a very good spine surgeon. We're in the process of trying to set this up. We have to work through customs to get cells brought, just some other stuff. We've been working on this for a while. So what we want is, if someone in Greece, in Athens, lots of car accidents and whatnot, big city, sophisticated medical care, gets an injury, goes to the hospital, the stem cells are there, they put these in, and these people are going to do better. And we are hoping, if we can get this set up, that it will be a model for kind of the rest of the world and maybe show other people what can be accomplished. Greece also does a lot of IVF, actually, and there's a doctor from there who's very interested in doing this, a very sophisticated center, so we may be starting that as well. So, anti-aging. Stem cell treatment is perhaps the most effective anti-aging tool. It can improve memory, vision, energy, joint health, appearance, your heart, and strength. We are perhaps the only stem cell center that tests patients before and after stem cell treatment. So if you Google stem cells and anti-aging, you'll find lots of things by lots of people at lots of places. However, we are data-driven. So every patient that we do, and we get very well-to-do people. I've showed you some pretty sick people with some severe problems, but we see a lot of people. We've seen some from Tony Robbins' group, Fountain Life, and others who are pretty healthy but want to stay that way, and they're 50, 60, 70, whatever, or they're starting to fade a little bit. So we get a test called True Age, which tests your DNA epigenetic quality, telomeres and methylation. At least we try. We tell people about this, and we tell them we want to do it. And most do it, some don't. Microbiome, gut quality. We have a few patients whose microbiome quality has gotten much better afterwards. See, we hear about these things anecdotally, so the question is, how often does it happen? And the way you find that out in medicine is you do a study and you see. It's just hard to do, and it takes a lot of calling and a lot of work and some high-end research people to do it, but we do. So sleep quality, we encourage everybody to get an Oura ring, and you'll see something about that in a minute, to measure sleep quality and heart rate variability. EEG brain function. With Dr. Royer, we've been doing a study of EEGs, getting ones on everybody beforehand and then remotely afterward. I actually paid for these myself so we can get data. We've got 20-some people, and we're in the process of going through our data. General inflammation, a blood test for that, and we're working on some immune system function blood tests as well. Skin and hair. Skin is usually visibly improved after simple IV infusion. We get these socialites and other people, these ladies, and they're 50 and 60, and they say, wow, people have been telling me my skin looks better. Hair is consistently thickened with scalp injections. So this on the left is thinning hair in a female, And on the right, this is like 4 months later, and it's noticeably thicker. And you can't really see it unless you look, but there's all kinds of little new hairs growing too. So this effect should continue to get more pronounced over the course of the year. So Eduardo Maristani in Naples. How many know Eddie? So he's the best. He's the best functional medicine doctor on the planet. My only problem with him is that he's so much in demand that I can't always get my patients into him, but he usually squeezes people in. So Eddie came down and got stem cell treatment. And he had a couple of medical things too, which I won't mention, but this is him. I
have an Oura ring, which is how I track my sleep and my heart rate variability and a lot of other biometrics. And I've had 2.5 years of data on this Oura ring. And just to give you an example, within 2.5 years, on average, I average 1 hour of deep sleep per night, which is pretty standard for most Americans. An hour of deep sleep is enough. So in a 7-hour sleep window, if you get 1 hour of deep restorative sleep, you typically feel pretty good and pretty rested. But children, a toddler, they get 4, 5, 6 hours of deep sleep, and that's why they're growing so fast and regenerating. As an adult, you typically can't get more than an hour and a half. It's kind of tough. So on the best day, 2.5 years of data, I got 2 hours of deep sleep. 2 hours, 15 minutes was the best I ever recorded. The day after stem cells, I had 4 hours of deep sleep, which is mind-blowing. The day after that, I had 4 hours and 45 minutes of deep sleep. And since then, for the last 2 weeks, I've been averaging anywhere from 2.5 hours down to my regular hour. It's intermittent. But I've had more deep sleep in the last 2.5 weeks than I've ever had in the lifetime of my Oura ring tracking. So I can tell you that it definitely assists you in getting more quality restorative sleep. What I also noticed is that it improves your heart rate variability, which was a pretty outstanding fact. So heart rate variability is a marker of your cardiac health. So the higher your heart rate variability is, the healthier you are. For example, if you take a 20-year-old Olympian, they can get their heart rates up very quickly, and when they slow down, their heart rates come down very quickly. And that's called high heart rate variability. It goes up and it goes down very quickly, which is good. You want that. If you're less in shape, and let's say you're 40 pounds overweight and you're 60, and you go run for 4 miles, first of all, when your heart rate gets up to 160 and then you stop to rest, it's going to stay up there for a while. It can stay up there for 10, 15 minutes potentially because you're out of shape. That's called low heart rate variability, which is a marker of poor cardiac health. So the Oura ring's been tracking my HRV for 2.5 years, and I go anywhere between 20 on a bad day to 45 on a good day. 45 being a better day. I've never gone over 70, ever, 2.5 years. The day after stem cells, I was 100. My heart rate was 100. And the day after that, it was 80. And the day after that, it was 60. And until then, I'm averaging now maybe 30 to 50, which compared to my previous average is way higher. And so there's no question that the stem cells actually rejuvenate your heart, even how your heart responds to stress. What's the most bizarre to me is after stem cells, when I went go for a run, so, my heart rate variability was so much improved. It's like if I was 20 years old. I mean, I never seen this where I get my heart rate up to 150, and typically to get that back down to 100, it would take 5 or 7 minutes. And now in 1 minute, it's back down to 100, which blew my mind. So there's no question that it improves your cardiac health, it improves your sleep quality, and you can only imagine all the other benefits it's doing, because we think those stem cells are alive for about 3 months in your body, just rejuvenating and healing your immune system and your whole system. So I think that, given all the data that we have now and everything that we can record and measure, stem cells are literally the most powerful anti-aging device that we have. And in addition to that, there are doctors that are starting to record brainwave EEGs and EMGs before and after stem cells, and they're seeing huge differences. People are seeing differences in the microbiome before and after testing. So we think these stem cells have a lot of pluripotential healing abilities that we don't even know about yet.
Does this happen in everybody all the time? I don't think it does. And that's why we're doing the study, so we can see who does and who doesn't, and how to maximize it, how long does it last. John's a 53-year-old, made a lot of money in the stock market, doesn't need to work anymore, former Marine and weightlifter whose body was ravaged by premature arthritis, tendon disease, and lung issues. And he came to Antigua.
This is my second treatment. I live in chronic pain. I came down here to Antigua about 2 months ago. I received my first treatment, and my pain went from about a 7 to a 2. So I'm here again to do it again to keep the momentum going. Dr. Prodromos is excellent. Everything is very smooth, to the point. You know, the injections are no problem. The IV's no problem. You know, there's really no problem. Everything is smooth here. The resort is beautiful. I'm pretty in tune with my body, and when they did these stem cells, they do 50 million at a clip through an IV. And I was just laying there, and all of a sudden, I felt my lungs opening up. I just took a breath, and I just kept inhaling. I was able to inhale more and more and more. And I says, oh my God, I said, this stuff is working right now. 100% go with Vitro Biopharma, the AlloRx stem cells. These are definitely probably the best in the world. And I would definitely recommend Dr. Prodromos and coming down to Antigua. I did this 8 weeks ago. I'm totally different. My energy level went from a 2 to a 7. I'm good. That's why I'm here again. I want to keep the momentum going. And I plan on doing it again probably next year, maybe in May. I'll do this again, and probably once a year for the rest of my life.
Anti-aging. We have something we've introduced called the Salamander protocol. Salamanders can regrow limbs. So using lymphocytes along with stem cells, we are able to take dead heart tissue and get rid of scarring, work on the brain. So some older people come in for treatment because they're a little older, slowing down a little bit short-term memory loss, but some people it's a little worse than that. So if it's the former, you can inject stem cells. If it's a little worse, we can bring them down, and we can use stem cells for the heart, for the brain, for bad joints. My 80-year-old brother, and we do this in Buenos Aires. He was down there for 3 weeks, just got back from there. This exists nowhere else in the world. And we're excited about it. It's a little more involved. It takes about a week. You have to take some lymphocytes out through a process called apheresis and activate them in stem cells, but it's painless and it's safe. I have a 501c3 nonprofit, the Forum, Foundation for Regenerative Medicine. We perform rigorous clinical trials and publish in high-quality journals. My mission is to bring stem cell treatment to those who need it in an evidence-based, rigorous fashion consistent with the highest standards of American academic medicine. We also have a fund for those who need but cannot afford stem cell work. Your donation will immediately help patients get better without the inefficiency and long delays inherent to large universities. Some very wealthy people from the Hamptons just fully funded a 20-year-old paraplegic who was from that area to go to Buenos Aires. He has to live there for 6 months and had no way to afford this otherwise to do that. And so the people there they could have given their money to a university, and hard to know where it would go. They could have bought, a piece of expensive artwork, but sought to donate their money so this young man can walk again. I believe there is no better use for your tax-deductible donation. If any of you have interest in helping support our work, please let me know at the conclusion of this presentation. I have some well-to-do patients so I should raise money for this, and we're entitled to. I just haven't, because I don't know how to. I don't really like asking people for money. My patients said, you should do this. So several of them got together and formed a board, an auxiliary board. This is like last week. And they said, you do medicine, we'll do that. So this is getting formulated as we speak. And the money goes to 2 places. It goes to fund research, and it goes to pay for people who need care but can't afford it. We are happy to answer questions and evaluate for possible stem cell treatment by Zoom remotely at no charge. We have a great team and a great research team. And also the email, Lindsay is our stem cell team leader, does a great job. Our website's on there too, so I'd urge you to peruse that if you have further interest. Thank you all very much for your attention.